You swallowed it with your morning coffee, maybe a sip of orange juice. It took you all of 5 seconds,
moved on
and then you moved on with
morning
your day.
for months.
The way you have
Maybe
moved on
years.
every single morning for months, maybe years. You don't think about that little pill anymore. It's just part of the routine, like brushing your teeth. It's just part of the routine, like brushing your teeth. But here's something almost nobody tells you on the day they hand you that prescription. If you are over 60 and that pill is amlodipine, losartan, or lisinopril, your body is quietly doing things in response to it that were never fully explained to you. And the gap between what you were told and what is actually happening inside your blood vessels right now is exactly where the trouble tends to hide. Let me tell you about a man named Walter, 73 years old, a retired postal carrier from Ohio. The kind of man who never missed a day of work in 30 years and never missed a dose of his blood pressure medication either. He kept his pills in a little plastic organizer with the days of the week printed on top, and he was proud of how careful he was. His daughter Karen called my office on a cold Thursday morning. Her voice was tight, the way a voice gets when someone has been worried for too long and finally decided to say something out loud. She told me her father had stopped driving. He'd gotten dizzy standing up from the kitchen table one too many times, scared himself, and just quietly handed over the car keys. He hadn't told his doctor. He hadn't told anyone. He decided all on his own that this was simply what getting old felt like. Walter had not had a stroke. His heart was not failing. He was living smaller and smaller every week because of something that had a name, had a cause, and had a straightforward answer. He just didn't know that yet. And that silence, that quiet acceptance, very nearly cost him the last good years he had. I'm Dr. Alex Mitchell. I've spent decades sitting across patients exactly like Walter. And what I want to walk you through today are the 9 things every senior taking one of these 3 medications genuinely needs to understand. Not because your doctor is keeping secrets from you. Far from it. It's because a typical appointment gives a physician maybe 10 or 12 minutes, and you cannot properly explain how a 70-year-old body responds to these drugs in the time it takes to write a prescription. So most people walk out with a bottle and a number, and almost nothing in between. Before we go any further, I want you to do something for me. Drop your age in the comments below and tell me this. Since you started your blood pressure medication, have you noticed anything you quietly chalked up to just getting older? A symptom you decided wasn't worth mentioning? Write it down. Because someone scrolling through these comments tonight believes they're the only one going through it, and your honesty might be the thing that tells them they're not. And if clear answers about your own body or what you've been hunting for, go ahead and subscribe right now. I put out new guidance every week for seniors who are done being talked at and ready to actually understand what's happening to them. Here's the thing. Almost every senior I meet describes the same appointment. A few minutes across a desk. 2 words: high blood pressure. Then a prescription. Take it once a day, and we'll see you in a few months. No one explained what's inside your arteries. No one mentioned that a body at 70 reacts differently than a body at 45. And so most people believe something that isn't quite true. They think the medication has fixed the problem. The reality is more interesting than that, and a lot more important. There are 9 things I want to give you today, and I'm going to tell you right now that the 9th is the one I carry with me if I could only keep one. So stay with me all the way through. This builds piece by piece. Let's start with the first thing, which is simply understanding what these three medications actually are, because they are not interchangeable. People lump them together as blood pressure pills, but amlodipine, losartan, and lisinopril work through 3 completely different systems in your body. And because they work differently, they cause different side effects and send different warning signals. If you don't know which system your pill is acting on, you can easily misread what your own body is trying to tell you.
Start with amlodipine.
This one is what we call a calcium channel blocker. Picture the walls of your arteries. They're wrapped in a layer of smooth muscle, and that muscle squeezes or relaxes depending on one thing: calcium moving into those muscle cells. When calcium floods in, the muscle tightens, the artery narrows, and your pressure climbs. Imagine tiny doorways along the artery wall that let calcium in. Amlodipine closes most of those doors. Less calcium gets in, the muscle relaxes, and your pressure comes down. But notice what it doesn't do. It doesn't undo whatever made your vessels tight in the first place. It manages the result, not the root. Now lisinopril, which belongs to a family called ACE inhibitors. Your body manufactures a substance called angiotensin II, and that substance does 2 things. It squeezes your blood vessels and it tells your kidneys to hold on to extra fluid. To make that substance, your body needs an enzyme. Lisinopril blocks the enzyme. Think of it as switching off the assembly line that builds the tightening signal. No assembly line, no signal, and your pressure eases. And because it also eases the strain on your kidneys, lisinopril is often the choice for seniors who are managing both blood pressure and the early stages of kidney trouble. One pill, two jobs. Then there's Losartan, which is what we call an ARB, an angiotensin receptor blocker. It works on the same system as lisinopril, but at a different spot. Lisinopril stops the signal from being made at all. Losartan lets your body make the signal, but it blocks the lock the signal has to fit into in order to do its work. The message gets sent, but the door is bolted shut, so the message never lands. And here is the difference that matters most to you. Lisinopril causes a dry, nagging cough in a real percentage of patients. Losartan almost never does. That's the reason a doctor sometimes switches you from one to the other. It isn't that one is stronger. It's that nobody should lie awake coughing at 2 in the morning when a simple swap can fix it. And speaking of the things your body does that nobody warned you about, let me come back to Walter's ankles, because that's where his trouble really began.
Amlodipine relaxes the small arteries in your legs
much more than it relaxes the small veins. So blood flows down into your legs easily, but it has a harder time getting back up and out. Fluid leaks into the surrounding tissue, swelling. And that's why your shoes feel fine in the morning and tight by dinner time. It's why the puffiness is gone when you wake up and creeps back as the day goes on. This is not your heart failing. It is not your kidneys breaking down. It is a predictable, mechanical consequence of exactly how this particular drug behaves in your lower legs.
What made Walter's situation dangerous wasn't the swelling at all. It was that he didn't tell anyone. He felt embarrassed by it. So he started skipping doses on the days he wanted to go out. And his blood pressure quietly climbed for weeks while he stayed silent.
So hear me clearly. Report the swelling. Don't hide it. Skipping your medication to avoid swollen ankles is far more dangerous than the swelling ever was.
That brings me to the third thing.
And it's one of the sneakiest. And it's one of the doesn't always show up when If you're on lisinopril, have you picked up a cough since you started it? Not a chesty, productive cough, a dry cough, a scratch, a tickle, the kind that nothing seems to clear. Here's what catches so many people off guard. This cough doesn't always begin right away. Sometimes it shows up months after you start the medication. And by then, nobody connects the two. They blame allergies. They blame dry air, acid reflux, the change of seasons. They buy lozenges by the bag. Switch their laundry soap. Run a humidifier all night. And the whole time the answer is sitting right there in the pill organizer every single morning. I had a patient, Lorraine, 68 years old. Nearly 5 months after starting lisinopril, she developed a tickle in her throat that simply would not quit. She wasn't sleeping. She was exhausted and frustrated and convinced something was wrong with her lungs. When I asked her to think back to when the cough started and line it up against when she'd begun the medication, she went quiet. Nobody had ever told her the lisinopril cough. Now, a dry cough is annoying, but it is not dangerous, and it can be solved. Report it, and your doctor can usually switch you to something like Losartan. But there is one symptom connected to these ACE inhibitors that you cannot wait on, not even for an hour. If your lips, your tongue, your face, or your throat begin to swell, especially if it becomes hard to breathe or swallow, that is an emergency, and you need care immediately. In rare cases, these medications can cause a reaction called angioedema, and it can turn life-threatening in minutes. So let me make it simple. A dry cough, report it. A dry cough, throat or tongue swelling, Now I want you to think about your kitchen, because the fourth danger isn't in your medicine cabinet at all. It's probably sitting on your counter or in your pantry right now. Both Losartan and lisinopril can raise the potassium level in your blood. And when potassium climbs too high, it starts interfering with the electrical rhythm. The warning signs are quiet ones: a little muscle weakness, an odd cramp, a heartbeat that seems to skip, and sometimes nothing at all, until it suddenly becomes serious. Now look at what's in your kitchen. Those salt substitutes that proudly say heart healthy on the front? Many of them replace sodium with potassium the electrolyte powders, the meal replacement shakes, every one of those can quietly pour more potassium into a body whose medication is already holding on to it. I think of Howard, 74, who switched to a potassium-based salt substitute because he genuinely believed he was doing his heart a favor. He was on Losartan. Nobody had ever connected those two facts for him. He started feeling weak and washed out. And when we checked, his potassium was dangerously high. Howard wasn't careless. He was disciplined, and he was trying to do everything right. The problem was never his effort. It was a gap in the information he'd been given. So read every label on every heart-healthy product in your home, and ask your doctor directly. Given my medication, is a potassium-based salt substitute safe for me? And while you're checking your kitchen, the fifth thing means checking your bathroom cabinet too.
the moment this video ends. Look for ibuprofen. Look for ibuprofen. Those everyday pain relievers you reach for when your knee acts up. If you're taking Lisinopril or Losartan, especially alongside a water pill, regular use of those over-the-counter pain relievers can cut blood flow to your kidneys and raise your risk of kidney injury. It isn't that any single one of them is a villain. It isn't that any single one of them is a villain. In a body that's even slightly dehydrated, they create a situation your kidneys struggle to handle. Nobody brings this up at appointments because ibuprofen doesn't feel like real medicine. Ibuprofen doesn't feel like a drugstore shelf, so it slips under the radar. So ask your pharmacist this exact question. Given everything I'm taking, is it safe for me to use ibuprofen regularly? That conversation costs you nothing, and it might head off a problem nobody saw coming because nobody thought to ask. The sixth thing is one I wish every senior had taped to their refrigerator because it's about what happens when you get sick. Because it's about what happens when you get sick. If you're on Losartan or Lisinopril and you come down with something, vomiting, diarrhea, heavy sweating, can't keep fluids down, the medication that worked perfectly yesterday can behave very differently today. These drugs are designed for a body with a steady fluid balance. When illness drains that away, the very same dose can now push your blood pressure down too far and put real strain on your kidneys. The medicine didn't turn dangerous. The medicine it's working inside changed overnight. The body it's working inside changed overnight.
I remember Raymond, 78, barely keeping water down.
Stomach bug. But he took his Losartan that morning anyway, because in his mind, a missed dose was a failure, and he hadn't missed one in over a year. That evening, he stood up and nearly went down. The medication wasn't the culprit. His medication wasn't the culprit, and his pressure had simply dropped too low. So write this down and put it where you'll see it when you're feeling rotten. If I can't keep fluids down, I call my doctor before I take my blood pressure pill. The seventh thing is going to surprise you, because it's about the readings themselves. The most dangerous blood pressure number isn't the highest one you've ever seen. It's the one you took at the wrong moment and then made a decision based on. Your blood pressure is moving all day long. Your blood pressure is moving all day long. With stress, with caffeine, with whether you're standing or sitting, and yes, even with the anxiety of worrying about checking it in the first place. A single reading isn't a verdict. It's just a snapshot of one moment. There was a patient, Joanne, 67, who checked her pressure every time a wave of anxiety hit her. She had pages and pages of numbers. Convinced her Lisinopril had stopped working entirely. When we slowed everything down, same time of day, same arm, sitting quietly for 5 full minutes first, a completely different picture appeared. Her medication was doing its job beautifully. The chaos had been in how she was measuring. So measure at the same time each day, in the same chair, with the same arm, after resting 5 minutes. Respond to patterns, not to single moments. One number is just single moments. A pattern is real information, and only real information deserves a decision. The eighth thing explains something I've watched play out for years. 2 patients, same age, same medication, same exact dose, same medication, completely different results. Same exact dose, and completely different results. The body it's working inside is not. A diet heavy in salt means more pressure building up in your vessels. So your medication has to fight harder just to hold steady. So your medication has to fight harder just to hold steady. Floods your body with stress hormones that tighten the very vessels your pill is trying to relax. Extra weight piles on cardiovascular strain that no single medication can fully offset. And sitting still day after day stiffens your artery walls over time. When your medication and your daily habits are pulling in the same direction, your numbers stay stable and your doses stay low. Your numbers stay stable when they're pulling against each other, the doses creep up. Not because the medicine is failing, but because the system is fighting itself on 2 fronts at once. The best results never come from the medication alone. They come from the medication alone, plus the world it's working inside of. And that brings us to the 9th thing, the one I told you to wait for. After all these years and thousands of these conversations, the single most important truth about these 3 medications is the one almost never spoken on the day the prescription gets written. None of these medicines erases the condition that's causing your high blood pressure. Amlodipine eases how tightly your artery walls squeeze, but it doesn't undo the stiffness that built up in those walls over decades. Lisinopril shuts off the enzyme making the tightening signal, but it doesn't repair the changes in your vessels that made those signals fire so often. The signal needs, but the signal keeps getting sent. All 3 of these drugs manage what the system is producing. None of them shuts down the system itself. This is why your follow-up appointments matter even more than that first prescription. This is why the lifestyle piece isn't optional. This is why a perfect number on a chart doesn't mean the conversation is finished. The patients I've watched do the best are not the ones taking the most pills. They're the ones who came to understand what their medication was doing.
They're the ones who came to understand what their medication was doing,
and then chose to live in a way that was not doing.
both of those
and then
truths
chose
at
to
the
live in a
same
way
time.
that worked
So let
with
me
both
hand you
of those
something
truths
practical
at the
to
same
carry out
time.
of here. If you take amlodipine, watch for ankle swelling that worsens by evening, dizziness when you stand, and flushing. Report it and never skip doses to hide it. If you take lisinopril, watch for a dry, persistent cough, even one that arrives months later, and remember the red flag that cannot wait. Any swelling of the lips, tongue, or throat means emergency care, immediately. If you take Losartan, read every heart-healthy label in your kitchen. Watch for muscle weakness, cramping, or an irregular heartbeat, and ask when your potassium was last checked. And for all three of these, never use ibuprofen regularly without telling your doctor. Call before your next dose if illness is draining your fluids. Measure your pressure calmly and consistently rather than reactively. And never, ever stop one of these medications suddenly without speaking to your doctor first.
Now let me tell you how Walter's story ended. After his daughter called, I had him come in, adjusted his dose, walked through what he'd been eating, and then I sat with him, not with his chart, with him, and explained everything I've just explained to you. He learned why he was getting dizzy. He learned it wasn't his heart giving out, and it wasn't old age stealing his independence. Within a few weeks, the dizziness settled, his pressure held steady, and Walter drove himself to the hardware store on a Saturday morning, which to him felt like the whole world opening back up. He told me at his next visit, "Dr. Mitchell, I gave up driving because I was sure my time was running out. Turns out, I just needed somebody to take 20 minutes and explain it to me." A few months after that, he printed out the things he'd learned and passed them around to the men at his veterans breakfast. A handful of them brought new questions to their own doctors. 2 ended up with medication adjustments that were long overdue. 1 had been writing off months of swollen ankles as nothing but old age. The answers had existed the whole time. The fixes had existed the whole time. The only thing missing was the conversation. That's exactly what this channel exists to do. After all my years in this field, the one thing I know without any doubt is that the seniors who manage their blood pressure best are not the ones on the most medications. They're the ones who understand what's truly happening inside their bodies and use that understanding to make better choices day after day. Walter didn't need a different drug. He needed a conversation. Lorraine didn't need months of sleepless coughing. She needed one question answered. Howard didn't need to stop trying to eat well. He just needed to know what was already sitting in his cupboard. Information isn't an extra. Information is part of the treatment. So let me leave you with one question. Which of these 3 are you taking right now? Amlodipine, Losartan, or Lisinopril? Just type the name down in the comments. That one word tells me what matters most to you, and it tells me what to break down for you next. And before your next reading, carry this with you. Do I actually understand what my medication is doing inside my body right now? And just as importantly, what it is not doing. If your answer isn't a confident yes, that is not your fault. That gap is exactly what this channel exists to close. I'm Dr. Alex Mitchell. Subscribe so you never miss the kind of guidance your health deserves. The kind that reaches you before the emergency you never saw coming. And I'll see you in the next one.